Hi, I just wanted to say thank you so much for choosing Dr. Chandler and the rest of the OMS of Utah team to take care of your patient. My name is Micah, and I'm going to be going over some basic post-operative instructions that you'll need to know. You will be sent home with a post-operative instructions pamphlet that looks like this. The biggest, most important thing that we want you to know is that if you have any concerns or questions anytime throughout your recovery, please call our office. We do have a doctor on call nights and weekends. There's always somebody that can help you if you need anything. First, let's talk about pain control. We want our patients to know that they can expect their peak of pain and swelling to be on the third or fourth day of recovery. Typical prescriptions that we will be prescribing will include ibuprofen 600. We ask that you use that in addition to over-the-counter Tylenol at home as your main pain medications. If that's not quite keeping the patient comfortable, we will also prescribe a prescription for Ultram, which is an opioid and can be used on top of ibuprofen and Tylenol to control the pain. Please keep in mind that if any of these prescriptions are different, Dr. Chandler will review those instructions with you after the surgery. For swelling, we will be sending the patient home with an ice pack that looks like this. You can take this home and put it in the freezer. We recommend icing for the first 48 hours to keep swelling to a minimum. Bleeding is expected after surgery. When you get back to see the patient in recovery, you'll notice that we likely have them biting on gauze to help keep the bleeding under control. We recommend keeping that gauze in place for about an hour after they leave our office, just to help get the initial bleeding under control. You will be sent home with plenty of gauze that looks like this. So how we recommend that you fold these is they're going to come in squares. I like to unfold them, fold them long ways twice, like so, and then roll that about 3/4 of the way up, and then the patient is going to bite on that part of the gauze. I'm sure you're wondering what your patient is going to be able to eat following an oral surgery. We recommend that our patients stick to cool, soft foods for the first 24 hours. Anything really warm that first 24 hours can increase bleeding and swelling. So things like Jell-O, pudding, yogurt, ice cream, smoothies, all of those things are great options for the first day. After the first day, the patient may eat whatever they feel comfortable eating. Just keep in mind that we do strongly recommend our patients stay away from straws for the first week following surgery, as well as anything really small like oatmeal or nuts that can get stuck in those sockets. Patients will slowly get back to their normal diet as tolerated. "24 hours after surgery, we would like our patients to resume their normal oral hygiene routine. Regular brushing and flossing is acceptable. Keep in mind that some of the surgical areas may have stitches. Those stitches are likely dissolvable and will break up and fall out all on their own. It's highly likely that the patient will also be sent home with a prescription for an antibacterial mouth rinse. They should begin using this 24 hours after surgery. Light rinsing for the first week is going to help keep those surgical areas healthy and clean. After the first week, the patient is then going to transition to using a syringe. Will also be sent home with you that looks like this. At that point, they want to pull up that mouth rinse in this syringe, and they're going to use that to rinse out any lower extraction sockets. Those sockets tend to get food and things caught in there that can cause infection if it's left. A lot of people have questions on how to avoid a dry socket, which is a great question. Dry sockets are caused by any strong spitting, swishing, or sucking motions. So that's why we tell our patients no straws, no smoking, and no vigorous rinsing for the first week. Again, we just want to say thank you so much for trusting Dr. Chandler to take care of your patient. He or one of the other team members should be in shortly to discuss with you how the procedure went.